Research tells us that millions of Americans suffer from TMJ problems. The good news is that the vast majority of them can be successfully treated in a fairly short period of time without surgery. So let's talk for a few minutes in today's Focus on Dentistry on how we determine what your TMJ situation is. Hi, I'm Dr. Paul Henny, and the focus of this little segment is to really discuss in more detail how we determine what's going on with your jaw joints or the pain in your face that's likely associated with a TMJ problem. Typically, if you were a client of mine, I would have already had a conversation with you, and it was my feeling that the symptoms you were presenting with or the problems you were presenting with likely were a TMJ problem, and therefore we decided together that an evaluation or examination was the next appropriate thing to do in your case. So let me talk just a few minutes about some of the things that we do to figure out what's going on and what's going right and what perhaps is not going so well with regard to your jaw joint system. In a previous video, I discussed a little bit about the anatomy of the joint system, but let me spend a minute just sort of reviewing that. The TMJ is this part here, obviously the jaw joint. You have two of them, and there's a disc that's designated in blue in this particular model. The jaw joint system is a system that actually hinges open as well as slides open. It's actually a very complex design. So some of the problems that can occur with this jaw joint system are problems with the disc, problems with the ligaments that attach to the disc, problems with the muscles that drive how your jaws move, even issues with the nervous system in this area or even the vascular system in this area. And more often than not, there's more than one thing going on. You may have a source of pain or symptom that's actually one or two things coming from different places or different sources. So the center of our evaluation process is to kind of evaluate all of this, sort of pick through it and see where the sources of the pain are coming from, and if in fact they are related to the TMJ issue or not. For instance, a lot of clients come to me with ringing in their ears, and commonly they'll see an ENT and they'll be told by an ENT that their ear looks completely normal. So commonly what I'll do is I'll be evaluating a client who will have perhaps jaw symptoms as well as ear symptoms. So we'll look at that all in kind of combination and see if in fact what's happening in the joint is influencing what's happening in the ear. One of the things that we will evaluate during this process is actually how the teeth come together, because how the teeth mesh together influence how the joint works. Stresses that occur here end up here in the jaw joint. So that's why a dentist is typically one of the best places to go to evaluate a TMJ problem, because sometimes the bite is influencing the function of the joint or vice versa. So we look at that as well. We also listen to the jaw joints, and in a few minutes I'll show you how we do that in a couple different ways. And when we combine all of this information together with imaging, we usually can get a pretty accurate picture of what's going on with the jaw joints, and then from there we can develop a diagnosis as well as a plan of action that would be appropriate for your specific situation. So let's bring a patient back and let me show you a few of these things that we do as far as evaluation, as well as some simple treatments that we do that are very successful here. I'm here with Marcia, who's graciously agreed to be our patient for this little video. As I said earlier, the main purpose of this video is just sort of show people some of the things that we look at and consider when they come to us with a TMJ related problem. So as I was discussing earlier, we're going to focus on the jaw joints, which are here, and she can open and close for us. And a lot of people will present to us with noises in the jaw joints. Sometimes it'll sound like a very distinct pop or a click. Sometimes it will be a grating sound. Sometimes it will be some combination of those things. So obviously feeling for it and listening to it in various ways is helpful in us determining what's going on with the joint system. The other thing that we look at is, just bite together for me, Marcia, is the bite. Do the teeth come together properly? Is the function of the bite influencing how the joints work? So let me lean Marcia back here. I'm going to show you a couple things that we assess when we do TMJ problems that help us to develop a diagnosis, which is the most key thing that we do here, because you can't possibly successfully treat a person without an accurate diagnosis. So let's go through a couple of the steps that we take to try to get an accurate diagnosis. One of the things that we'll do with an individual is just check their range of motion. I'm not going to measure it today, but we just want to see what the mobility of the mandible, the lower jaw is. How far can they open? How far can they go side to side? Is there pain associated with that? Something else that we do is we listen to the jaw joint. This happens to be a Doppler stethoscope, so I can get a very accurate assessment of what the joint sounds like through a headset. There are very distinct noises that are associated with various changes in the joint. For instance, a joint that has bones that are breaking down is going to sound very different than a joint that has a disc that's wobbling around. So that the Doppler is another thing that we use. As I discussed earlier, we also look at the bite and how all of that may be influencing the joint system as well. We also look at the muscles. There are a number of muscles involved in moving the jaw around, as well as stabilizing the head and neck. So we assess the condition and functionality of the joint, the muscle system as well. The other thing that we do on occasion is do what's called a JVA, which is another sophisticated way of listening to the jaw joints. And we can actually put a headset on, which in essence is a microphone, and the microphone goes to a computer that has software in it, and the computer software listens to the joint sounds and then associates those sounds with known changes to joint systems. So we have a lot of data over the last 15 or so years that correlates very highly certain joint sounds with certain joint changes. So we'll use a JVA as another way to actually indirectly diagnose what's going on in a joint system. Then all of this is done typically in combination with images of the joints, from just a flat film image so that we can see the bony structures, all the way down to some sophisticated slices done with MRIs and sometimes CTs if we can't quite figure out what the changes are in the joint system. As I said earlier, most changes in the joint system are such that they don't require surgery for us to get things comfortable and stable again. Typically our goal is stabilization, not reconstruction of the joint. So in the vast majority of cases, that's what we're looking for, which cases are most amenable to what I would call conservative therapy, which is treatment short of surgical intervention. And one of the things that we will commonly use in a lot of cases is called a bite appliance, or sometimes we'll call it a bite splint. This is one that we made for Marcia a while ago. In this particular case, this one fits on the lower teeth like that, and it's set up to close against the upper teeth in a very specific way. It's also set up to have the teeth guide across it in very specific ways so that the joints are more protected, even if the individual continues to grind or clench their teeth. So there's certain strategic designs involved with these things. And this is really the big difference between something that we would do for a client versus something you would buy at CVS. A rubber bite guard that you would put in your mouth or warm up and mold your teeth and bite down on like an athletic mouth guard. Has no real control of the bite forces that are influencing the functionality of the joint and the muscles. So typically I'll see a client after they've done all of these things. They've gone to an ENT, they've been to CVS and they've bought the $35 bite appliance that doesn't work. They may have even been to one or two dentists who didn't really understand how to approach their problem, and sometimes they've been to a couple of physicians. So typically if we take these steps, these diagnostic steps, as well as render out appropriate conservative treatment in those cases where surgery is not really indicated, then typically within just a few weeks we can get most people comfortable and functioning pretty normally. That happens in, I would say, 90 to 95% of the cases that we treat. That's a big number, but it actually happens that way. So this is just sort of a brief overview of TMJ and how we approach non-surgical cases. Non-surgical cases, again, represent probably 95% of the people that we see. And if you think you've got a TMJ problem, you don't know what to do about it, and perhaps you've been to some other places and you just have not been able to get a clear diagnosis, we'd be happy to meet with you and assess your situation, give you opinion about what's going on, as well as what appropriate treatment would be for your situation. Thanks for visiting with you, and I hope to hear from you soon.